pleased to welcome you to this first webinar in the series on child, early, and forced marriage. So it's part of the efforts of the Gender and COVID-19 Global Working Group of practitioners, researchers, advocates, policy actors who contribute on topics around gender equity, empowerment, women and girls empowerment, human rights, and the focus, of course, on the current COVID-19 pandemic. And everyone is welcome to join. So the website is genderandcovid-19.org. So the aim of our group is to create a learning community of people interested in the prevention of child, early, and forced marriage. So we share knowledge on the subject, we exchange experiences, expertise. We try to learn together about effective prevention strategies and interventions. As we know, child, early, and forced marriage prevents millions of young people from living lives that are free of violence, from more fully developing their immense capacities. It's estimated that about 650 million women and girls alive today were married as children, and that about 12 million more are married each year, or around 23 every minute is an estimate. So the World Bank Group and the International Center for Research on Women, they analyzed some of the economic impacts of child, early, and forced marriage and found that economic benefits of child marriage prevention would increase each year because the impacts, of child marriage are cumulative. So starting in 2015, then, the amount saved just in the year 2030, so the annual savings that year would be over 650 billion US dollars, so trillions of dollars over the time frame of their study. So just to provide an order of magnitude, of the economic benefit to preventing child marriage. And of course, as the authors also point out, the benefits of preventing child, early, and forced marriage are not primarily monetary. So for those who are interested, the report is available on the icrw.org website. There are also data emerging about the effect of the COVID-19 pandemic and associated measures that have increased the risk and incidence of child, early, and forced marriage. And there are several reasons for this. So one reason is that amidst, the increased economic and food insecurity brought on by the pandemic, early marriage, may be seen to reduce some of this. For example, with less people in the household, and in some regions of the world, a dowry provided to the bride's family. Another reason is through the unfortunate disruption to schooling, which of course can be a strong protective factor. Finally, with increased gender-based violence reported and, kind of both the supply and demand side constraints to accessing care, there's also greater risk, heightened risk for early pregnancy. So what has been seen from this pandemic and evidence from other epidemics such as Ebola, so they show that both child, early, and forced marriage and early pregnancy increased among adolescent girls relative to non-epidemic times. So, while all these issues, I think, demonstrate that child, early, and forced marriage is a global challenge generally, and even more so during the pandemic, I think it's also important to remember that those adolescent girls who have endured it and suffered have showed tremendous resilience, tremendous strength, and continued on, contribute immensely to society. And the strength of these girls and women and anyone of any gender who's experienced this to transcend injustice is central, I think, to where we are today. We are together, we stand together, we are part of a growing community that's dedicated to learning, to study, to consultation, to action, to reflection on our action. So this webinar provides one space for such an exploration together. So today's webinar has two speakers who have worked in Sub-Saharan Africa and in South Asia. And I will introduce the moderator, who can in turn introduce the speakers. The moderator, Sushmita Mukherjee. Sushmita is the Director of Gender and Adolescent Girls Unit for the Project Concern International in India. And she and I have collaborated quite closely. So I'm delighted she'll be the moderator of this first webinar. So Sushmita, on to you. Thank you.
Thank you, Bahi, for giving that brilliant introduction and setting the context and the tone for this, our first attempt to bring the issues up front and in front of all the other audiences here. And without taking much time, I would also like to introduce our subject matter experts today in this thing. So we have Taranjeet Kang, who is a senior consultant and have years of experience of working in sub-Saharan Africa. And our other expert speaker tonight is Shipra Jha, and she is the head of Asia engagement for the Girls Not Bride Alliance. So maybe I'll quickly give the floor to Taranjeet to give a round of introduction for herself a little bit more.
Thank you, Sushmita. So my name is Taranjeet Kang, and I am a research consultant that's based in Juba, South Sudan, where I work as a freelance researcher supporting the work of UN agencies and also NGOs. I'm an interdisciplinary researcher, but of course, given the context that I work in, a lot of the work that I do involves both conflict analysis and also gender sensitivity. Thank you.
Thank you. And may I request Shipra to also introduce herself, please?
Sushmita, and thank you for giving Girls Not Brides this opportunity to speak here today. I'm Shipra, and I am working with Girls Not Brides. We work here in India, Nepal, and Bangladesh, and 5 states in India. We're also trying to start some scoping work in Southeast Asian countries, and we are focusing on ending child early and forced marriage. We work across the theory of change, which means we look at laws and policies to end child marriage, also working with communities, also working with girls and figuring out ways to empower them, and also ensuring that they get access to basic services. We work through members, and we have around 350 member organizations in South Asia. Thank you so much. I'm looking forward to interacting with all of you today.
Thank you, Shipra. So let us start our discussions and conversations, and maybe I'll start with Taranjeet first. So Taranjeet, given that we know that adolescents have been always a vulnerable cohort or group, so it would be great if you can share with us tonight that how child marriage and the vulnerability of adolescents were there in the pre-COVID scenario, and how the scenario changed when the COVID actually hit upon all of us.
Sure. Thank you, Sushmita. When in regards to Sub-Saharan Africa or even Eastern Africa specifically, there's a wide variety of contexts here. So there are some countries that have lower marriage to child rates and some with much higher. I think on average in Sub-Saharan Africa, the rate of child and early and forced marriage is about 40%. Where I'm based in South Sudan, it is a little over 50%. But there are some countries such as Niger where it is actually over 70%. So there's quite a wide range of contexts that we have within the continent. In addition to that, I think we also need to consider the fact that these are all very diverse and complex contexts. But we do see some of the general trends that you would also witness in other regions that are contributing to child marriage. Poverty is a key factor in this. And dowry is also practiced in many communities, maybe not all, but particularly in South Sudan. It is a payment that the man's family makes to the girl or the woman's family. And so at times, engaging in child marriage on the part of a family can be seen as one mechanism for raising funds when they are really struggling from a socioeconomic standpoint. In addition to that, there are a number of stakeholders that have been working on child marriage. There are civil society organizations, community organizations, Also governments in terms of implementing policies and legislation across the continent. In addition to that, of course, we also have a number of NGOs and UN agencies and others who are working on this. That's both in terms of, national NGOs within each country and also international counterparts that are assisting with this. But what we know just from across the globe is that legislation is not always enough. The enforcement of it is particularly important. And at times, and this can be a sensitive topic, sometimes the people that are responsible for creating legislation may be engaging in this practice, which makes it particularly difficult to implement any kind of law or policy that will hold people accountable and create that kind of a sense of justice on the part of girls and women, but also perhaps almost a sense of fear on the part of people who would want to force this onto girls. So I would say those are the key factors that we were observing. I think it's also important to mention that despite the fact that there is this prevalence of child marriages in some countries more than others in sub-Saharan Africa, we saw a lot of progress in certain areas and key factors that would help to decrease these rates. So, there were economic advancements in some countries. Tanzania, for example, in East Africa, was now categorized as a middle income country, which was great progress in terms of economic development, which is closely tied to addressing rates of child marriage. Access to education, there have been a number of interventions, different ones across the continent. In South Sudan, we have the Girls Education South Sudan program, which is called JESS, and it's funded by UK through their donor arm. And that was one key mechanism by providing stipends to girls to address one of the key drivers of child marriage, which is poverty. So there were a number of interventions that were occurring. But I think what COVID did was, unfortunately, it paused a lot of the things that were happening. A lot of programs and interventions couldn't continue until people kind of got a better sense of, what is safe to do, especially if you're working with adolescents one-on-one. A lot of times schools are also used as places, not just, to provide the formal education through the curriculum, but also places where feeding programs can be implemented, places where, dignity kits and menstruation supplies can be distributed, such as pads, to girls for free. It also gives them, other people in their community that they can turn to, for example, if they are feeling pressure from home. And when schools were closed in many countries, this also meant for girls who were in boarding schools and maybe had some kind of a distance from their communities and families and less pressure, they ended up having to go back to their communities and no longer had that kind of extra sense of protection from the schools. So there was a lot that was happening, but COVID definitely has inhibited some of the measures in terms of not just programming and aid interventions, but also, the kind of progress that was happening through education. And in many countries, but I would say particularly in South Sudan, we know that historically access to education has been very challenging for girls. And often parents, if they had to only pick one child in their family to send to school, it would probably be a male child. So that kind of progress that we were starting to see was interrupted. And now there's a lot of questions about how do we encourage re-entry into schools? How do we support girls returning to schools now that schools are starting to reopen? They're just reopening a couple of classes here in South Sudan, those who are supposed to sit their exams. And do schools have enough support to do that? And what happens to the girls who maybe became pregnant while they were out of school during this time period? There's a lot of stigma in allowing girls to return to school. Sometimes there's a fear that they may be a bad influence somehow on other students in the school. Now, if they happen to have gotten married during this time as well, it's no longer about getting permission or support from the parents. It's now getting permission and support from the husband instead. And they may not be an advocate for this. One of the challenges here in South Sudan, and I think in other places, is that we're often relying on estimates of child marriage rates. We don't exactly know. There isn't a lot of data collection on this issue, because government records, whether it's relating to marriage or even relating to birth or to death, or any kind of data collection, we haven't had a census since 2008. So tracking these kinds of events has become very difficult. So we work with estimates, and so we've had school administrators, local authorities, NGOs, civil society organizations that are the ones that are bringing the attention to child and early and forced marriage that has been happening in the community since COVID started. And also, highlighting the teenage pregnancy rates. And so we're relying on them for statistics and relying on them to identify what is the scope of the challenge that we're currently facing. But I don't think that there really have been any resources drawn together to try and address this. And one of the challenges is that in a place like South Sudan, where so much aid is already going to addressing the floods that have been happening, about half the country had been flooded earlier this year. There's parts of a country that have been impacted by intercommunal violence. The humanitarian needs themselves are already so great. And unfortunately, there isn't sufficient support on the part of the government, that figuring out how to address this and how to make it a priority is quite challenging.
Yeah. So Taranjeet will come back on understanding more that how COVID, along with the other humanitarian situations, has really made the situation complex for the communities and their adolescent girls. And now I would like to move to Shipra and maybe really try to understand that how in Asia you felt that, because Asia, in Asian countries, there were a lot of attempts being made to actually address the issue. There were many interventions being done to, improvise on the girls' agency, create awareness, a lot of laws. I believe, a lot of work was getting done. But maybe what all happened, what messed up the entire situation, and why suddenly there was a spike in the child marriage cases. So,
Yeah, thanks, Sushmita. That's a very important question. I mean, just to go back to your initial question, that what was it like pre-COVID? So pre-COVID also, I mean, if you look at South Asia, it is just behind sub-Saharan Africa in terms of the prevalence of child marriage. But in terms of burden, we were the highest. We have the highest numbers in the world, and around 285 million women globally alive are in South Asia who were married before 18. However, things were really looking up, as you just said, just mentioned, that there were a lot of positive laws in place, and at least Nepal, Bangladesh, India has clearly defined the minimum age of marriage. Bangladesh has exceptions. In Pakistan also, there were a lot of advocacy was going around at the provincial level and also national level to increase the age of marriage to 18. It is there 16 in many provinces. So a lot of efforts were going on. What was very important to also acknowledge is, before the COVID times, a lot of acknowledgement by the governments, and many governments in the region had come out with national strategies and action plans. Nepal, Bangladesh governments were very serious about implementing their action plans, and Girls Not Brides national partnerships in those two countries are partnering with the government and other agencies to actually moving forward in that process. So that was a big, I would say, important juncture for us, where we had got the attention of the governments in the region to acknowledge it as an issue and do something about it, actually develop a national action plans and strategy. And also there was a lot of positive discussion about allocating and spending budget on ending child marriage or reducing or addressing child marriage. However, what has happened is, and also a lot of discussion was happening in the civil society organizations about not just looking at laws and policies, but as you talked about agency, about broadening the discourse to taking it, not just keeping it restricted to age, but also talking about agency of girls and women, and not just talking about the minimum age of marriage at 18, but having giving them that kind of opportunities and choice that they can marry whenever they want. So we were able to have a lot of discussions to talk about positive things that we can do to reduce child marriage and also basically empower women and girls in the long run. So what has happened is that because of COVID-19, all this work that we were able to do has come to a stop, because main challenge that we face is that the government has directed all its resources and attention to either enforcing the lockdown or whatever measures are being taken to enforce that, or fighting COVID. So because of which there has been a lot of setback to the region, and the kind of progress we had seen, because as you must be knowing that in South Asia there was a huge decline in child marriage from 44% 10 years back to 29%. So we have been able to make huge strides in the region. However, with COVID-19 and the impact it has had on economies in the region, which were doing very well. Bangladesh was doing pretty well. India was doing pretty well in terms of economic terms. A lot of jobs for young girls, young women in the garment industry, other opportunities were available to them. The enrollment rates in school had all gone up. Now, we will discuss further in this session on how each of those sectors are so terribly affected and what is it that we can do.
Great. Thank you. So we'll just toss to Taranjeet now. So Taranjeet, how did you see that due to the mechanisms that were put in place to tackle COVID, actually took away all the support system and the agency, let's say in terms of education or skilling for adolescent girls, that all suddenly vanished? So could you just throw on light that what was the scenario on ground, maybe in South Sudan, and how the girls became more and more vulnerable? What is the community facing all about?
Sure. Compared to what Shipra just shared, I think it was a little bit different here because there wasn't really sufficient government support anyway going to education here. And a lot of the interventions, especially on the gender side, and especially at the adolescent age, was provided through aid actors. And I mentioned the JESS program before. So it wasn't so much a government support shifted, but one that aid programming stops, but also that schools shut down. And I think that had quite an impact on girls specifically, but also their families and communities at large. Poverty has been such a driving factor of child marriage in many countries, but I think in South Sudan in particular, it's been difficult to address this practice when even if you do awareness raising. So even if, there are civil society organizations, community leaders, and even government officials saying that, this is a harmful practice and we should stop it, it's hard to take up that practice when your family is dealing with so many other factors. Maybe they've just lost their home and their land and their crops due to flooding, or maybe they've been displaced due to conflict. And now we throw in another crisis at families. And even though the large majority of COVID cases have been concentrated in Juba, in the capital, and the majority of interventions relating to COVID have been implemented here in Juba, you don't feel the same sense of a pandemic when you're outside of the capital. But still, the economic impact has been felt across the country. Inflation rates have grown exponentially. So even families that had some kind of an income and had income generating activities, the cash that they have or had, any savings that they might have had, is no longer worth as much. So I think that, it's a ripple effect of many things, and it's not just one aspect or in one manner that COVID has been affecting families and child marriage practices. I think it's multifaceted, and the economic situation has quite a lot to do with it. And as I was mentioning before, the closure of schools, of disconnecting girls from these support systems, from their peers, from teachers, from, the civil society and other organizations that were providing programs, and giving them, a responsibility, something that they were doing that was a reason to delay marriage, has also impacted them. Yeah, I think that it's a very complicated situation here because the humanitarian needs were already so immense. and it's just kind of been exacerbated a lot as a result of COVID.
Yeah, yeah. Thank you. So, Shipra, so as you were just mentioning, so could you throw a little bit more light that how this entire support system got like disturbed at the closure of schools and this thing, and also maybe you can touch upon while talking that did digital like literacy, digital access, enable, disable, anything had any impact on adolescent girls?
Yeah. Yeah, so just picking up from where I left off, talking about how we had made strides in different sectors, and there was a lot of positive interventions going on. So if you look at the at the different aspects of COVID-19 and also the economic downturn, the most important, I think, the most negative impact has been the closure of schools and educational institutions. Now, it has been more than 9 months now, though in South Asia, slowly schools and educational institutions are opening, but it's not the same thing as in, it's either being done virtually or, through other mediums and not face to face. And maybe they're meeting once a week. So in this school closure, girls have been hardest hit, because what has happened is that earlier they used to get time to study, to focus on their schoolwork, to do academics, and now at home they are doing more chores. They are domestic burden has increased on them. That has been, and also the future looks very uncertain in terms of job opportunities and possibilities, and parents are very concerned about whether when school will open, or what is the future of educational institutions now, are they going to go back or not, and all that has increased to the vulnerability to child marriage and early marriage. And also what has happened is that a lot of their male relatives have returned. A lot of migrant working population has returned back to rural parts of the region, and that has also created that pressure on them. And the scrutiny on adolescent girls has increased. They're policing on them and where they are going, whom they are meeting, and probably you're aware, Shushmita, because you work in Jharkhand, that even if a family has resources, they are not available to girls and women. So even if the family can afford smartphones or laptops, they are usually used by the boys in the family, or or if they are shared with girls. There's a lot of scrutiny on whom they are talking to and what they are doing. So all that has increased, and what has happened is that many girls have reported increased scrutiny, and also not finding enough time for themselves, for leisure or studies, and that's really disheartening. And a lot of them have also are reporting mental health problems, or being depressed and other things. Also lack of health access to health services. We think whole government machinery directed to COVID response. Earlier, the government officials who were doing other things like distributing contraception, or keeping tab of other adolescent girls, etc., that is not happening that much. So access to SRHR services is also greatly reduced, and markets and all also shut down. So that also is there is a lot of vulnerability inside homes to violence. Lots of girls and women have reported violence, and risk of unwanted pregnancy and sexual violence. So all kinds of hardships they are facing at the moment. And of course, the economic hardship, which is cutting across all sectors, has the most, I would say, the most devastating effect on girls and women. And they are really they are losing jobs. And one thing that was reported from Jharkhand, where you work, is that when a lot of working male population has returned, earlier those jobs which are offered to girls and women are now being taken up by those migrant workers who have returned back home. So, for small jobs for which earlier girls were being considered after they finished their grade 12th or college, are now being, probably being taken up. And And the most important thing which I must mention is that as incomes reduce, girls being seen as an economic burden, that is becomes even larger. And now, as you know, that there are restrictions on weddings and number of guests invited. So families also feel that this might be a good time to get them married and reduce economic burden, as well as, they're not seeing much of, future possibilities or prospect of either them going back to their educational institutions or getting any jobs, because economies are in a huge downturn. So a lot of these factors are, I would say, complex factors which are playing around. And there's a huge digital divide. So even though many schools and colleges are trying, and even government is trying, either through phones or WhatsApp or, through virtual mediums, what is a huge challenge is that how many girls have access to digital technology and digital mediums. So that is something that we are still trying to struggle and trying to meet this challenge.
Great. So, so I would now turn to all our interesting audience and the participants here that our experts have spoken a lot about the kind of challenges. So I would request if the audience can put in the chat box that what do you feel are the top 2 challenges that the girls are facing due to the mechanisms put in place for COVID, addressing COVID. So request the audience, the participants, to use the chat box to write what are the top 2 challenges that from you feel that are really bothering the lives of the adolescent girls. Audience on the chat box.
I just wanted to share one example with you all, is that when we did a small research in Rajasthan, girls reported how they did not have access to sanitary napkins, and they could not go out to the market, and they could not, earlier they used to get it through school or through other, centers, or people, used to distribute it, government officials. Now they many of them went back to other hygienic ways of menstrual hygiene and management. So those are small examples of the kind of rollback we are seeing in the COVID times.
Yes. So request the audience to put in their responses that what you feel are the top 2 challenges that the girls, adolescent girls in your region, or maybe you feel you heard the experts saying are the top two challenges that the girls are facing due to COVID. And the next segment, we are going to talk about solutions and recommendations from our experts. So audience response. There's a brilliant audience around here. Great. So it's violence, poverty, increased domestic work, suffocation being at home, and constantly policed by adults in the family, no opportunity to share and learn. Thanks, Savita and Carmen. Margaret writes, pressure on household leading to sharpening of discrimination girls have always experienced. Very nice. Thank you. More. I see so many learned audiences there. It's general. What do you feel are the top 2 challenges that the girls are facing? I'm sure there are many which you face. It can be a repeat, no issues on that. Food insecurity, lovely. Yes, there has been shortage of food, and many times we hear, from our own PCS field experience, that the girls are now put into hazardous, jobs. There has been increased cases of sex trafficking, child trafficking. There has been, I would like to just share an interview conversation that one of our field staff had with one of the women in Jharkhand, where PCI is working on a project to eliminate child marriage. And they said that, we are now actually eating upon the money that we had saved to marry off our daughter. And now if we are completely consuming out that savings, it would be difficult for us to resave that amount to marry off our daughters. Although they didn't speak out of the child marriage or early marriage or forced marriage for their daughter, if that's in their mind. But that's a huge thing. Well, the respondent was actually broken and informing and sharing their situation with our field staff. So of course, back on field, back on ground, the situation is so unpredictable. People do not know what to do, and somehow marrying off their daughters to safety, is being interpreted as if they are married off, they are all safe, and how the harmful effects are outweighed by this choice that, okay, if you're married, you're safe, you're done, and just you're. But this lack of understanding about that, if your daughter do not have the agency, and even if she's 18 or 50, she cannot take decision, and that is not the solution to her life, is something which is still missing, and something which is still troubling all other development sector. So thank you for the brilliant responses. I would love the audience to be more engaged and provide their reactions, keep on providing their reactions and responses in the chat box. And let's now move to the next segment where we would talk about the solutions. Although there might not be solutions as the COVID is continuing and this is all unpredictable. So over to Taranjeet. So Taranjeet, could you just tell us that how in Africa situation, which is not only struggling from COVID now, but it has been struggling with its own political crisis, its natural calamities of floods and droughts as a annual periodic cycle thing goes on. Mm-hmm. What are the kind of solutions that are getting tested to address the scenario?
Yeah, I mean, it's been an interesting year because South Sudan was kind of just on the cusp of creating a new government after signing the peace agreement a couple of years ago. And it feels like, it's the educational processes, the political processes, the financial processes and development and progress we would have expected to see this year have all been interrupted and regressed in many ways. But in terms of solutions, I would like to go back and highlight the JUST program that I mentioned before. So this is probably the biggest gender-based intervention that South Sudan has ever seen. It was implemented nationally. And in its initial stages, its primary purpose was to provide stipends to to female learners that were enrolled in school. And it was particularly important because it included secondary schools. Now, historically, across the world, aid actors have mostly supported primary and basic education. And secondary education, especially in a place like South Sudan, where historically educational access has always been an issue, secondary school was almost seen as a luxury or, a challenge to address later. So to provide, girls with this increased access to secondary education was quite revolutionary in a way, in an educational sense. And it was meant to address the issue of poverty. So in South Sudan, as in many countries, actually, primary education is meant to be free. And students are supposed to be able to get the support that they need. And even, at the secondary level, a lot of countries constitutionally or through other legislation give students the right to attend school for free. But what we find oftentimes in countries, especially low-income countries where there's a challenge with adequate government support to schools, they end up charging registration fees, even if they don't charge tuition. And that registration fee can be a hindrance. And so what we're finding now, even in relation to COVID, is that, families haven't been able to save up the money they usually would because they didn't know when schools would open again. The economy, has regressed in many ways as well, and is facing many challenges. So having an intervention like JUST, which addresses poverty, is really key. But we know that it's not enough to just show up and have a student show up in a classroom in order to ensure that they're getting a quality education, that they're able to continue and complete school, especially for girls. It's one thing to enroll and to start school. It's another thing to complete all the way through secondary school. And actually, at the time of independence in 2011, it was estimated that a 15-year-old girl was more likely to die in childbirth than she was to finish the first 8 years of education. So what the JUST program also does is it provides support to teachers to improve the quality of instruction. It provides capitation grants to schools so they can improve their facilities. The toilet facilities, for example, are one key aspect in being able to encourage girls to go to school and to feel safe and comfortable there if they have their own separate bathrooms and, they're of a standard that they're able to provide, adequate privacy. And also, when girls are menstruating, that's something that they definitely need access to. So I feel that it's addressed the problem in a multifaceted way, which is really important. And I think that, on a broader scale, not specifically a gender intervention, but when looking at the impact of COVID, whether it's economically or in terms of early and forced marriage and GBV as well within homes, we need a multifaceted intervention. I've gone to communities and done research following awareness campaigns, and what you find is that the communities have very good awareness of the issue. They understand how it's harmful, but the behavioral changes haven't occurred yet. And so we also need to understand, I think, that this is something that will change over generations and not immediately. I would say in addition to that, we need to consider the role of men. I think that there's been a trend among programming relating to GBV or even to child marriage that is emphasizing more, that it's not just something that women need to take responsibility for, even girls themselves, because it's really oftentimes the men who have the most power within a community and therefore are probably in the best position to start addressing some of these harmful social norms. In addition to that, I would also say that I think it's something that takes a multisectoral approach and takes and requires a vision that is long-term. So, okay, we get girls into primary school and, this is one mechanism or shows a positive correlation for reducing child marriage rates. But then is secondary school available to them, especially for girls in rural areas, unless they leave their homes and go to a nearby town or urban area, it's very difficult to access that. And then once they finish secondary school, are jobs available? Is university accessible? So we need to think of it from a pipeline perspective, I think, rather than just focusing immediately on the challenge that's in front of us. Thank you.
Great, thank you. Definitely a friendly school having all the mechanisms available for them to cope up with the puberty related changes and transition into adulthood is very essential. I'd like to now open up to Shipra, and maybe we can also learn what are the kind of solutions or COVID adaptations that has been you would like to share us to enable to that. What can be done to address?
Yeah, thanks, Sushmita. And just, what Taranjeet said about primary education and educational infrastructure and quality is totally relevant also in the South Asian context. That, how do we advocate for at least ensure that educational inputs are reaching more and more students who don't have digital access. So I'm really happy to share that despite the very unprecedented crisis situation, lot of good interventions have happened. And so the most important thing which I would like to share is that when there were, people were facing, especially women and girls were facing a lot of crisis immediately in the lockdown period, lot of civil society organizations, they partnered with the government to distribute relief, to distribute rations, distribute, sanitary kits, sanitary napkins, and we were really happy to that to see reports and a lot of stories were shared with us that many of the organizations were able to make sure that these responses are gendered. So that was something that we saw a lot, that there was a lot of our members, they started partnering with the government in responding to COVID. A lot of organizations started stitching masks, and they rose to the occasion in trying trying to partner with with the government in COVID response. So there were many heartening things that we saw. So solutions cannot be, as Taranjeet also was saying, that they have to be multi-sectoral, and we have to all work together, because it's not something, it's a complex issue, as we all know. So civil society working with government and trying to, I think, where things are looking positive are where we are keeping in touch with adolescent girls and the community. Wherever, there have been collectives of girls and women who have been activated, who are active, and organizations working on the ground, community-based organizations, are able to keep in touch and ensure that, nobody is getting married, or whatever distress situation is there, if it can be addressed. Also, keeping pressure on district officials to respond, to keep the helplines open, to continue with whatever health access or whatever schemes were there earlier available, and whether they are being implemented or not. So but the most important thing in this scenario is having a very active civil society organization or community based organization, which has been able to kind of function so smoothly, and able to also map what is going on in their area and respond accordingly. So there have been also many organizations have conducted campaigns. I mean, recently Room to Read conducted a campaign called Har Kadam Beti Ke Sang, which was where they involved all stakeholders, parents, government officials, ministers, on talking about how do we ensure that the girls in each and every family have access to some online device, or they get access to education. So many different organizations are trying to think innovatively, trying to think about how can they what can we do, because all our hands are tied. I mean, we are not able to travel. There are many travel restrictions, so nobody wants to risk their also staff, and also we cannot cannot do gatherings. So wherever possible, in groups of small groups, trying to ensure. I can give an example from one of the collectives, that they have one smartphone which 5 or 7 of them kind of use to access whatever life skill module that they get once a week. So trying to transact our programs through virtual mediums, and trying to switch to whatever is possible, community radio or any other medium. Also many organizations who were running life skill centers, or skill based centers, are trying to make adolescent girls computer literate, so that they can use Zoom and other platforms more. They become more comfortable. So and the good thing is that the young are very adept at it. They learn very easily. So there has been some heartening stories of how in remote areas of in India and Bangladesh and all, women and girls have tried to connect, and organizations have connected with them, and trying to keep their programs alive, trying to meet this challenge. Also, a lot of local fundraising has happened, and a lot of initiatives for asking people to donate their smartphones or donate their old laptops, so that children from who are who don't have these gadgets can access them. So a lot of local support has been also galvanized to kind of find some effective solutions to this unprecedented crisis. And I'm hopeful that also what has happened is there's a lot of discussion and debate also, that people are recognizing that girls are vulnerable to child marriage, that adolescents might not go back to schools and colleges. So there is already that awareness, which I find as a very good thing, that there is, even the government officials are alert that this is a problem and how do we address it. So these things are, I would say, the silver lining in a cloud. However, we all have to step up and work collectively and support each other, and also try to ensure that how do we keep pushing the government to kind of, address these challenges that have come due to COVID and the economic crisis.
Great, thank you. I request the audience to keep putting their comments and questions on the chat box. We are at the very last segment and very timely done as well. So Taranjit, maybe my last question would be, it was a great sharing about the challenges and the solutions that are getting done and halt. So what is your maybe top 3 or 4 recommendations, because we have audience here who are from the not only from the non-profit sector, who work very closely with the communities on ground, who advocate with policymakers, who work in alliances, who work with multi-sectoral and multifaceted things. So it would be good. What is your recommendation for this audience to take back?
Yeah, I think that's kind of a difficult question, because I think we could make a very long list of all the different things we could do. I think one is just addressing poverty. It alleviates so much pressure and tension and so much burden. And I think it helps families also see the possibility of, okay, if we allow and support, the girls in our family to go to school, we will not be losing, a primary source of income or even labor in our family, but we can actually benefit in the long term if we are able and willing to make this investment. So I think that, addressing poverty and giving families some room to breathe and to consider the future. I think that so many families who are enduring this humanitarian crisis right now are just in survival mode. And so, the idea of saving up for school fees and making that kind of investment is just so far out of as a realistic possibility. I think the involvement of men is an absolute criteria for this as well. I think that, I think sometimes it gets a bit complicated, because you find in some families that even the mother of the child, it may be somebody that's encouraging or placing pressure on her to get married at a young age. But a lot of that pressure that's even on the adult women in the family comes from, the societal patriarchal cultures that they're living and working in. And so I think at the end of the day, look at who has the most power in the community and work with them to try and address some of these practices. And yeah, so that would be the top 2 that I can think of. And then I would go back to the point I made earlier about just having a multi-sectoral response.
Great. Thank you. Shipra, maybe your top 2 or 3 recommendations.
Yeah, Shushmita. So, what I would say that we have to find ways of supporting any voices which are around us and which oppose this practice, and ensure that wherever possible, how can we contribute, what are the ways we can contribute towards ending inequality and justice, because child marriage ultimately is about gender inequality. So how do we raise our voice, and whichever part of the world we are in, we can sign petitions, we can share on social media handles, we can raise our voice, we can write about it, we can protest, and we can also contribute to women's organizations, women's rights organizations, which are fighting to end child marriage and also end other forms of violence against girls and women. So we have to think, that which are the ways in which we can contribute in the community we are in, and also through our work, or become part of some movement or some work somewhere. For civil society organizations, I mean, our recommendations are basically, if we have to how do we keep our programs and our work going, how can we keep in touch with our with the communities where we work in, and how can we constantly try to ensure that things don't go horribly wrong there, and at the same time constantly putting that pressure on the government to keep this issue alive. And not if for example, if there is a social protection scheme in place, and why is it not working, why is it not covering vulnerable families? And if there is nothing happening, and most of the cases, if you notice in South Asia, there are many schemes but they don't get implemented. So we can as civil society organizations push for implementation of these schemes and ensure that vulnerable families are covered and girls are not married out of economic hardships. And at the same time, this whole advocacy around reopening of schools, and when schools do open, we really need to go and track who are the girls who are not coming back, who are the children who have dropped out, what are the reasons. So there is a lot of a lot of things that we will need to do. Of course, once things become a bit better, and but whatever is possible virtually or through phone, I think we should try our best to keep the issue alive and not let attention shift from it, especially in the light of the UNFPA prediction of 13 million child marriages, additional child marriages in the next 10 years. So that's a very alarming statistic before us, and that should be like a wake-up call for all of us to get out of our comfort zones and do something. So I would say that these would be my few recommendations.
Thank you, Shipra. I think your alarming statement is really alarming, with so many girls still getting day by day, year by year vulnerable. Is an alarming, as we are all practitioners and believe that this norm needs to be completely eliminated, no shifting. And we are great. We are on time. There are a couple of questions. Maybe if I request experts if they can look into the chat and respond if possible. And we know that we learned that ensuring that the agenda is alive, ensuring girls are speaking, ensuring that men are also involved to say that I don't want to marry now, or I don't want to marry anybody who is young, I don't want to marry anybody who is not so educated, XYZ. I think the men's role also cannot be ignored, or rather needs to be built into the central part of it. I'll now hand it over back to our colleague Bahi to bring it to a close and give it a nice submission as well. Over to you, Bahi.
Thank you very much. Thank you. Thank you to the speakers and the moderator. We're learning together, and it's really heartening to hear of efforts to render meaningful service in this field of the prevention of child early and forced marriage during the pandemic. Far from viewing it as a time of hiatus in activity, as was mentioned, as possible, given the circumstances. There's more to do and still, I think, much to learn. So this webinar, provides one space for people with personal and professional experience with child early and forced marriage of any gender, background, culture, faith, to explore this issue, to give us a chance to identify, to articulate, what we've been learning, both strengths, challenges, those effective and also cost-effective strategies on which we can build in our efforts to promote, the protection and also the development and empowerment of adolescents. So on behalf of our group, we're interested in continuing this conversation together with the many people who are learning about child early and forced marriage prevention. There's a concept that there's a great transformative power in thousands of actions by a growing number of people bound together in a common framework. And I feel that, probably most people in the world can find a point of unity in some aspect of this work. We're contrasting perspectives overlap. So again, all are welcome, all perspectives, all experiences. So thank you again to our speakers and to our moderator, and thank you all again for joining today. Take care.
Thank you, everybody. Thank you. And this is the close to our session. And please visit our webpage. It's there, the link on the chat box. And looking forward to a continued discussion. Thank you.
Thank you so much. Thank you. Nice meeting all of you. Thank you. Bye-bye.